Good evening, everyone. It gives me a great pleasure in welcoming you all to this webinar on future proofing mental health and wellness. Without further ado, we will start today's session with welcome address. I request Mr. V.N. Shivashankar, Vice President SICI and founder VNS Legal to deliver the welcome address.
A very good afternoon to all of you. Dr. Balaji, Chairman, SICI Healthcare Committee and Vascular Surgeon, Apollo Hospital. Dr. Mahesh, Geriatric Physician, Apollo Hospital. Dr. Chitra Arvind, Psychologist and Founder, Manas. Ms. Sai Bhuvaneshwari, Entrepreneur, Psychologist, and other friends who have joined us today. It gives me great pleasure in welcoming you all to this important session titled Future Proofing Mental Health and Wellness Post-COVID Strategies. I'm happy to be part of this event on mental health and wellness, not only because it is a topic of utmost importance to all of us today, but also as a Chamber of Commerce, if we need the industry to bounce back strongly, mental and physical well-being of the employees will be of paramount importance. And SICI, as part of its contribution towards nation building and as an interface between businesses and the government, is happy to organize this for the benefit of our members. Today, I think more or less people are reconciled that COVID is not going to vanish anytime soon, and it may be prevalent in probably different variants with hopefully lesser effects. And at this stage, the best we can do is to continue following all precautions as part and parcel of our daily routine and maintain a healthy diet and lifestyle, which is necessary for us. Challenges facing the industry are manifold today. None of them saw the second wave coming and with such severity. So the first wave was something which was quite a bit of a shock to the industry, but the recovery was swift. So you would have seen how the papers have reported a V-shaped recovery. But this, the second wave has really taken a significant toll, not only on the financial impact, but also emotionally. A lot of companies are now quite doubtful on how they can go for expansion. They're trying to get more out of what they already have. So naturally, this leads to expectations from both the employees being much higher, and the employees are also going to be under much more pressure, both physically as well as mentally. We have seen newspaper reports that people who have had an exposure to COVID continue to suffer from a lot of symptoms like fatigue, physical limitations for continued longer periods of time. And this, I'm sure, would affect their work and productivity. We have an excellent team of panelists who will deliberate on this in much more detail. Psychological impact is also an extremely important factor, especially amongst the elderly section. And I'm happy to note that Dr. Ganesh would be speaking on this. The kind of ecosystem which India had earlier, which gave some sort of protection to the elderly community, unfortunately is no longer there. And the elderly population not only is subject to COVID exposure, but also continued exposure to the social media and what is reported there creates more stress and damage to them in the long term. While most of them have physically recovered from the disease, it has not gone out of COVID, has not gone out of their mind. And I think that needs to be addressed. Employees who have unfortunately suffered COVID and are trying to recoup themselves, trying to pace themselves back, they need to plan on what they are going to do and make sure that they don't overstrain or overexert themselves. They have to plan it in such a way that the best of their work is done at the best of the time. As regards companies, the post-COVID syndrome, the new illness and the symptoms have still not been fully understood by the companies and the employers. This has resulted in a lot of employees not reporting back to work fully. So this is something where the company must be encouraged to have counseling, psychological counseling, must be encouraged to look at the challenges being faced by the employees and see how to support them. Some companies have taken the lead, which is very encouraging, but I'm sure much more needs to be done. So the need of the hour is certainly to remain both physically, mentally, and emotionally strong so that we can continue to participate in the fight against this pandemic and also engage in our productive activities daily with due care and precaution. So having said that, and with an encouragement to all participants to view all this with a lot of positivity, strictly following the COVID SOPs, I welcome all the members to this session today. Over to you, Bhavani. Thank you.
Thank you, sir, for your warm welcome. Now we move on to the main session. I request Dr. V. Balaji, Chairman, SICKI Healthcare Committee, to deliver the theme address. Dr. Balaji is a senior vascular and endovascular surgeon in Apollo Hospital and adjunct professor in TN MGR Medical University. He has 10 years of experience in general vascular surgery and transplantation in UK. He had done his fellowship in pancreas transplantation at University in Minnesota, Minneapolis, USA, and fellowship in endovascular surgery at University of Cologne, Germany. He is the first overseas Indian to pass FRCS Inter-Royal College Board exam. He is also a recipient of Harris Fellowship from Rotary Club Chennai for serving the society. And also IIM Chennai has honored him with the Best Doctor Award in the year 2009. With these words, I request Dr. Balaji to address the gathering. Over to you, sir.
Thank you, Bhavani. Good evening to you all. I thank, at the outset, I thank SICKI for giving me this opportunity. I'm not sure how many of the participants and the delegates knows about SICKI. As you know, SICKI is an industrial body which is more than 110 years old. And basically, this industrial, this chamber works as a liaison between the industrial bodies as well as the government, so-called the bridge between the industries and the government to have a nice coexistence so that everybody gets benefited and there's a smooth policies being followed up so the industry goes very well for the sake of the community. Why healthcare is in this chamber? People would know olden times healthcare is used to be like, you know, it's a one-man show running a hospital, but now the healthcare has been corporatized. As you know, when Apollo Hospital was started more than 35 years ago, there was a first corporate hospital, then the private institutions started coming up, then the healthcare has become an industry. Obviously, there are a lot of investors in the industry, so we want a lot of improvement in this industry, and that is what our chambers does. As you know, this chambers has got many verticals, and healthcare is one of the very important industry now, which is we are looking at multi-trillion rupees business in healthcare of different verticals. People will know healthcare as only as a hospital healthcare, but there are different branches for healthcare. For example, diagnostics, which can be lab or radiology, or you have device technologies. As you know, there are a lot of implants coming up. They have instruments, for example, you all know about ventilators, monitors, etc. Pharma industry. And what is growing up recently is the two different verticals, what you call telemedicine, especially in this COVID situation, where doctors cannot see the patients physically. There are a lot of virtual appointments. In fact, there are virtual treatments happening. The doctors sitting here can manage patients far away. For example, even doctors here can manage the ICU in the US. And secondly, the medical tourism, or what's called medical travel values, MTVs, which is gradually growing up. And what is the current status of Indian healthcare industry now? As you know, the Indian healthcare consists of two types of system, which is running parallelly, which is private as well as public. Public managed by the government, and the private, which is run by a lot of private sectors. As you know, even the private started very late, as I said, only the last 35 years or so. Today, as we speak, only nearly 70% of the patients are being managed by private health sectors. only about 30 is in the public health sector. The recent COVID has completely exposed what has been happening to the public health sectors. As you know, the healthcare has been a state subject by constitution, it's a state subject, and somehow it has become what's called a concurrent list. That is, both the central government as well as state government started contributing for the development of public health system. And today, because of the COVID pandemic, both the first wave and the second wave, we saw there are a lot of issues just happened and exposed the system here. What are the downsides of the system? What's happening here? Not just here. We should see what is happening in the so-called developed countries, in the Western countries like US, Italy, Spain, for that matter. What has been the initial problem with our Indian healthcare industry? The investment in the form of the public health system. Today, the Indian government spends approximately about somewhere around 1.5% of the GDP or so, hoping it will be around 2.6 in the next few years. Hoping. It's not happened as yet. When compared to approximately 16 to 18%, which happens in US, or about 10% what happens in Australia. Still, you can see what's happened there both in US as well as in India, and no amount of public health infrastructure can meet the challenges of what happened in the COVID situation as happened today. But still, India has to invest a lot of money for the development of public health so that a lot of poor people can get access to this. Then comes the next point. There is a lot of lopsided in the healthcare industry today. As you know, India is home to 1.35 billion people, and majority of them still live in the rural countries. When India got the independence, 90% of the population was living in rural sector, and today, because of the migration and the population explosion, the metros, etc., about 70% of the population is still living in rural. And if you look at all the healthcare developments, what it spoke about private health sector and things like that, they're all concentrated mainly in the metros or the tier 2, tier 3 cities. So you can imagine that 70% of the population still do not have affordable, accessible healthcare. And that is one of the downside of the Indian healthcare delivery system. And today, coming to the topic of the COVID pandemic situation, what are the best practices in the post-COVID scenario, as well as the mental health. For that, you should know what is the current scenario happening in India. So only then you know the quantum of the problem, what as Shiva was talking about, quantum of the problem, what everybody is facing in our country. As we speak, India has had about 27 million population affected by COVID, and we have had about more than 300, that is 3 lakh deaths, 311,388 to be precise. If you look at the numbers, it took 156 days for the first 50,000 deaths. And do you know how many days we took for the last 50,000? Just 12 days. The last 12 days, we had 50,000 deaths. That means even though we've been able to mitigate or contain the COVID to a certain extent, there are a lot of deaths happening in our country. That is 10 times more than what it started with. And in Tamil Nadu, we have more than 1 million, that is 19 lakh people have been affected, and we've had 21,000 deaths. And as of yesterday, nearly about 450 people died in Tamil Nadu. And this is the current situation of COVID in Tamil Nadu and India. I hope the last few weeks of strict lockdown, we are able to turn the corner around, and the numbers are certainly showing the numbers going down, and we see the bed situation getting slightly easier. I wouldn't say we are under control, slightly easier. We all have some bit of breathing space in the hospital. So it is very pertinent that we are talking about this impact of pandemic, impact of COVID in both in the industries as well as mental health. Everybody has suffered to a certain extent because of the COVID. Maybe rich or poor, or young or old, wherever you are, whichever part of the world you are. The mental health issue seems to be predominantly a major issue in the post-COVID era, especially when you're going to come back after this control of situation. Like for example, in somebody's talking about the industries. Even at home, people have been locked up for more than a year. We're talking about kids who cannot go to the school, who cannot meet their friends, who cannot go for any entertainment, etc. They're all having some kind of mental issues. And today we have lovely speakers who are going to talk about some mental issues in the post-COVID eras. And Dr. Mahesh is going to talk about the COVID practices which has to happen in industries so that when the lockdown gets eased up, or so-called the unlock happens, when the industries open, we don't get back in the situation of third wave, etc. So with this, I thank Siki for giving me this opportunity to lead the healthcare team, as well as giving an opportunity for moderating this panel discussion. I hope you all have a fruitful discussion, and everybody, all the participants gets benefited, and they have some kind of take-home message, and we all have a safe life in the future. Thank you very much, and all the best for all the speakers. Thank you.
Thank you, Doctor. Now I would like to introduce Ms. Sai Bhuvaneshwari, who is going to moderate this panel discussion. Ms. Sai Bhuvaneshwari is an entrepreneur, life coach, and a counseling psychologist. Sai stepped into entrepreneurship world after almost 20 years of association with top corporates like Hitachi, HCL as part of their senior management. She is the founder of Meraki Consulting, which mentors various startups. And with a quest to understand human minds and to give back to the society, she started a The Mahi Mind Matters, through which she provides coaching and counseling. She is also a motivational speaker in many forums. With these words, I request Ms. Sai Bhuvaneshwari to take forward the session. Ms. Sai, over to you.
Thank you. Thank you, Bhavani. Thank you, Siki, for the opportunity to chair the panel, which is very, very relevant in this time. Thank you, Dr. Balaji, for explaining the reality today and also how our healthcare system is trying to cope up with the pandemic era that is there. Thank you for also the tidbits on the telemedicine, medical tourism, etc. As we all were hearing Sri Shankar as well as Dr. Balaji, we are in peak of our pandemic wave across the country. We all are trying to cope up at personal and professional level. We are slowly learning the art of survival, slowly understanding what is mattering the most. But there is always a lingering question in our mind. What if I get caught with the virus? What are the right ways of preventing measures? We all think about our near ones, us, dear ones, etc. But the set of healthcare professionals who is risking their everything that's close to them just to help us, to make us cross over it by walking by our side. As I think it was mentioned, rather realized many a times over the last year that God is busy about. Hence, he sent the doctors and healthcare professionals down. Let's hear from one such savior, Dr. Mahesh. I'm happy to introduce Dr. Mahesh. Dr. Mahesh is a consultant geriatrician at Apollo Hospitals, Chennai since 2007. He was also a consultant in University Hospital of Teesside, UK till 2007. He has his MBBS from MMC 1995 batch, MRCP from UK 2000, UK board CCT in year 2005. He has presented in many forums like British Geriatric Society, American Thoracic Society, and national conferences. He has also published many papers in age and aging journals, UK and Indian journals. He is also the secretary of Indian Academy of Geriatrics. Dr. Mahesh, over to you. We are all looking forward to hear from you.
Thank you for the kind introduction. I'd like to thank Dr. Balaji and Siki for giving me this opportunity to share my thoughts and participate in this panel discussion. It is a very unique situation of great human suffering we are in, and I think everybody must acknowledge and understand this, and this time what we are living in and what we are going to live into in the near future is very unique, and so I think we have to use a different lens when we are dealing with our day-to-day problems, be it in the industry, in the corporate world, or as individuals. and to use bring out tools more of compassion and kindness in us when we address anybody and any issue. So with that background, I would like to go into my main remit of my talk, which was to look at how the situation will be in the near future when we unlock or when we come out of this lockdown and start getting back into our normal work routines. Can I have the presentation, please? Next slide. So I think the way of looking at it very simply is to try and keep the assessment simple. How am I going to make my workplace safe for my employees? And as individuals, each one, how they're going to look at it is to first have a team or a group of members. The organization size may be different, might be a small organization or a huge organization, and depending on their willingness to partake time and resource towards this exercise, which is very important, is to assess risk. And it will be risk for the employees themselves, for the workers, and if it is a service industry or industry where customers are expected to drop in and to look at risk from their point of view as well. So once the risk assessment is done, then we have to think of best practices in trying to reduce the risk. Next slide. And when we look at both risk assessment and risk reduction, to have a framework of looking at it from the workplace point of view, what is it which has to be different with COVID and the COVID prevalence situation, which is likely to be for a few months from now on. The risk prevalence of COVID might reduce or vary from state to state or from district to district within our state. So there would be government guidance. Now we have extreme form of guidance in that we should shut shop, have a lockdown where there is minimal or no human interaction at all. But as the prevalence of COVID reduces, which we all hope will happen, then we would start unlocking as we did last time. So the main threat of spread when the prevalence is starting to reduce is when from the workplace point of view is areas which have poor ventilation. This is an example. So to look at how each one's workplace at point of ventilation and to try and identify areas which are high risk for COVID transmission, and then look at a risk in terms of workforce. So example would be how many of our workforce in an organization are 50 plus. So increasing age is an increasing risk of COVID. So those who are 50 plus with comorbidities, to identify that, and those who are 60 plus. And in terms of trying to look at how people travel to work, I know there will be organization with a lot of young employees, so they can kind of be fit for work and be able to withstand infection, but the risk of infection might be there in the way they travel to work if they're having to take public transport. So we have to look at risk from the workforce point of view, and again, as individuals, everybody in the organization should have an open conversation and try to create an environment of positive dialogue rather than trying to adopt a negative approach towards individuals who are at risk of COVID or who have fallen sick with COVID. So the environment is very important of positivity, which will encourage more participation from everybody in the organization towards mitigating or reducing the risk. So the key message is, even if an organization is not able to spend a lot of money or time, resources towards modifying the workplace, one thing they can do is to create this positive dialogue, an environment of positivity towards approaching this huge issue which will energize everybody, all the individuals in the organization to participate, and that human change in human behavior is a key factor in reducing the risk. Next slide, please. Next slide. While you're looking at that, and I think what organizations should realize is what is good for an individual is good for the entire organization. And we have seen extreme forms of risk reduction. Everyone would be familiar with the Indian Premier League, the IPL cricket, where the organization was willing to take everybody into a bubble and have frequent swabs. And that is an extreme form of risk reduction. What would be simpler things which are more applicable to industries is educating everyone about the importance of self-reporting. And next slide, please. So self-reporting, where if they have any suspicious upper respiratory tract symptoms, cough, cold, or tiredness, or fever, and if they have elderly people in the organization, atypical presentation where they feel unusually tired or finding difficulty to walk, mobilize. These are atypical presentations in elderly, where to kind of sensitize people to these symptoms and to report them, and to have a policy of isolating them and giving them to stay 3 or 4 days of observation at home or isolation at home before it is clear whether they are indeed going to fall ill, or if this is atypical, this is not COVID. So to have a culture of self-reporting and not to create a penalizing environment for reporting symptoms, because if we can, the only way to beat COVID is by prevention. I think once somebody gets an illness, it's difficult to predict who is going to get a severe illness, and the resources used and the suffering by the family once they get to severe COVID is unimaginable, to say the least. So I think the way to beat it is prevention. It would cost the individual organization some resources and finances when they have to have people off frequently on suspicion of COVID. But the way to look at it is to reduce the number of employees, have the employee come to work and spread infection at workplace inadvertently. Another way of looking at it is to invest in temperature checking every day for employees when they come to work. And if there is any suspicion of high temperature, is to give them mandatory 2-3 days off and observe. And also organizations to have policies. Individual organization have to tailor it to their budget and their convenience of how the swabs will be tested, who will be taking it, and if everything is left to the employee, the cost might be too much. So I think each organization has to have a team looking at all these situations in a close way, and to have a policy which is transparent and consistently applied, so everybody gets the confidence and don't get a feeling of being vindicated. Next slide, please. So once as individuals, we have talked about how to assess the workforce, increasing age and diabetes, and also think of once we have assessed them and trying to protect them, if they are very elderly, think of giving them tasks which can be done from remote or to work from home. Those are some options which some organizations have already taken. Next slide. So when we come to, once the assessment is done, when we come to risk reduction, we have to understand that the most important way of, next slide please, way of reducing risk is by having shielding devices, basically masks, and and the organization should look at this investment in masks as a positive thing and come up with a policy of what type of masks they should be using, and especially when the prevalence is high, and to kind of invest in providing masks for both customers and employees on a daily basis, and in which way the risks can be reduced. When there are organizations which expect a lot of customers coming in, we have looked at shields where there is it reduces the transmission if the customers are not wearing masks or if they're wearing ill-fitting masks. And there are a few other adoptions which are mentioned, like staggering lunch times, basically to reduce human interaction over the next few months, thinking innovatively so that we have reduced the chances of transmission. Next slide. So in this picture, we see masks and then the paints where in a reception area where the staff employees protected from the risk of transmission to an extent. Next slide. And as individuals, each individual has to take his health very important and get a baseline health status checked. The important risk factors for worsening COVID is hypertension, diabetes, and obesity, apart from increasing age. So to get their health status checked, quite often what we have noticed is because of lockdown or fear of getting COVID while visiting clinics or hospitals, many of them have not kept up their routine appointments, and that has led to a deterioration in their health condition. So we have to encourage people to have their health status reviewed. If not physically, there are a lot of online modes of consultation now to encourage them to get their health status checked and keep their health status at an optimal level. Next slide. Next slide. So, and all these, as mentioned by our earlier speakers, involves a lot of resources and effort from both organizations and individuals. So the solution should be tailored according to each one's needs. And next slide. Wherever possible, professional support should be taken. If a group of companies can get together, then they could be able to have the services of a physician who's specialized in this. In Western countries, we have the occupational health department, which is also here in India, but I'm not sure how deeply they're involved in small and medium scale industries. But this is typically a role of the occupational health physician to look into the benefits, needs of the individual employee, and being an interface to connect with the employers and the physicians, local physicians, to provide health. And so if as an individual organization, they can't access a group of organizations, companies should get together and get professional support, because there are a lot of clinical queries and situations which would need a professional approach. One thing which would be possible to start planning now is on vaccination. I think apart from masks, the effective weapon we have against the COVID is vaccination. And the vaccines available in India have all shown to be effective once both the doses are taken from severe COVID infection. There's a lot of misinformation also being spread both on media and social media about, and the focus has been on how vaccinated people have fallen ill. But I think the focus will not be on the good aspect, which how many exposed vaccinated people have not fallen ill. I think there is always, the media has a focus on the negative news. So I think there is a fear among many people that vaccination may not be effective. So I think focus as organizations should be on masks and vaccination, and to encourage not only the individual but his extended family, because this is very transmissible disease, and we should make an effort as organizations to support and guide and see if a group of companies could organize vaccination camps, because right now we have some difficulty in accessing vaccination. if that can be organized by the companies which for the employees and their families, that would definitely help in the next few months of combating this reduction in COVID. There would be also a lot of requests about returning to work, who should be tested, and a lot of need for mental health support. I'm sure we have a speaker who's going to discuss more on the mental health aspects next. Next slide. Yes, I think despite prevention, sometimes we do need hospitalization and the costs are quite high. And this is a time for the companies which have resources is to look at providing health insurance for families, employees' families as a whole. Next slide. So the key take-home points was from me is to first assess and reduce risks at workplace, both for the workplace, workforce, and individual employees. Emphasize on masking, try to ease arrangements for vaccination, and try to have a culture of positive attitude at workplace and to address COVID to move forward. Next slide. If time permits, there are a few other situations which I wanted to touch upon, but I think in interest of time, I will stop here.
Thank you, Dr. Mahesh, for taking all of us through workplace risk assessments, workforces, how do we protect them individually, as well as for the overall workforces. You also touched upon nitty-gritties like the insurances, vaccination camps, masks, etc. As you rightly said, the reality awaits us when we face the post-pandemic world. We are all surviving now. I think we need to learn how to thrive the situation. Companies right now who are handling the crisis is realizing that workforces are requiring new capabilities to face the digital and a newly changed environmental world or the future. The question when we see all this we have in mind is, will the pandemic end up having a positive or a negative effect on corporate ways of working? What are the impacts of mental health on mental health, and how do we handle it as companies, as individuals, as managers, as leaders? Let's hear from Dr. Chitra, and I am so happy to introduce her. Dr. Chitra Arvind is an RCA certified consultant psychologist and in the field of psychology for around 2 decades. She did her PhD and MPhil in University of Madras. She has also done her diploma in human resource management. She founded Manas, A Pursuit of Happiness, where she's playing varied roles in the gamut of psychology, starting from trainer, consultant. She's an author, speaker, life coach, psychotherapist, etc. She has been providing consultancy services to various corporates, educational institutions, and social bodies through counseling and training programs. She has done workshops and lectures, not limiting to resilience, POSH, communication, stress, emotional management, life skills, all other things. She has won various awards for her academic pursuits. She had authored books, scientific journals, and serving as an expert for various online magazines. She has been a resource person for various visual and print media. I'm so happy to welcome Dr. Chitra to present next.
Thank you, Ms. Sai, for the nice introduction, and very good evening to all the august audience present here. And I thank Siki for giving me this opportunity and to be part of this webinar to convey my ideas on mental health. And I'll be, without wasting much time, I'll just start the presentation. So as the topic rightly says, future-proofing mental health wellness. So Dr. Mahesh beautifully talked about the physical health wellness for the employees part. So here I'm only going to throw light on the mental health wellness part. But physical health leads to be talked about physical health, and many of you definitely know about physical health and its impact on your life. And COVID has been playing a very negative role in all of our lives right now, and we're all in a very grim period. But having organizing such webinars to give more positivity is very enterprising. So here I would like to even give a little bit idea about mental health also, because not much awareness is given in these areas. So I'll be spending a little bit time on COVID-19 and mental health, how it is having an impact on mental health. And then I'll be going to the corporate area wherein I'll be talking about the employees' mental health needs as well as how to develop resilience. So that's a very nice concept, and we can apply in the corporate sector, like how to improve the resilience of the employees at the workplace. So when we talk about physical illness and mental illness, this picture itself can tell you the amount of difference it goes with it. Like, for example, when we say like, I feel like I'm dying, and when there is a COVID illness, definitely we would say that, okay, we'll just go to the hospital ASAP. But when we say like, I feel like dying because of anxiety or other disorders or depression or whatever it may be, it's all new feelings. And people don't understand that suffering, and they would say that just try and remember, a lot of people have gone through it. And they just try to brush by saying that it'll be fine. Just think about God and everything will be fine. But mental illness is a reality, and it just cannot go by itself with all these advices, and it needs intervention. Counseling and psychotherapy is very important for mental illness. And now we could see COVID-19 has brought in a lot of mental health issues also, along with its major impact on a person's life. And also, rightly, we are talking about here, it has got an impact on employees' life as well. Employees' work life and his work-life balance, everything is going for a toss because of this kind of work from home things, which has got both its pros and cons. Probably we'll be discussing those in panel discussion. So to tell something about employee well-being and how important it is, it's a state of, according to World Health Organization, we would define a health. It's not only the absence of disease, but the presence of physical, mental, and social well-being. And it's very important to emphasize in such a webinar where August audience are there, we need to understand the employee well-being in this perspective. It's not just, if you don't have any disease, it's not like I'm healthy. It's also about enjoying the mental health as well as the emotional health and social well-being. It includes your choices and activities aimed at achieving the physical vitality. For example, if whether you're going to choose smoking or drinking, or whether you're going to choose exercise and right eating, and also following a proper lifestyle, this also depends on your mental health. And employees who are healthy and well motivated can increase the productivity also. So that's the good news for the corporates as well. So when they are enjoying the health, both physical and mental health, obviously they'll be more well motivated, and their productivity also will increase. And what are the impact of positive mental health on a person? So they can realize their full potential, because as a corporate in an organization sector, we can't say like we are fully utilizing the person's potential. So it improves the full potential of the employee to have a healthy relationship and avoid any kind of crime or victimization, to make right choices. And just now I mentioned about making right choices and coping with daily stresses of life. Now COVID-19 has come, and everybody are coping with the stresses. Some people are succumbing to it. Some people are thriving. Some people are struggling. So it all depends on your resilience or the mental capacity to bounce back from the adversity. So positive mental health, enjoying positive mental health will allow us to cope with the stresses of life without breaking, and also to work productively and to maintain your physical as well as mental health. So right now we are facing challenges because of COVID-19. Just to name a few, is like work from home. It's a very new concept. I wouldn't say for all the sectors, but for few sectors, it's a new concept, work from home. And there are a lot of pros and cons in it. Some people are enjoying, some people are not very much into that. And COVID fear is shaking all of us. We're all human beings, considering me and anybody here in this presentation, anybody here in this webinar also, we would say that definitely we're all facing COVID fear. When will it affect my near dear ones, like Dr. Balaji said rightly. So we're all facing this fear right now. And there is no social support also. People cannot step in and come and help. Probably virtual support is possible, but not a face-to-face support. So we are having that issue also. And about being confined at home. After all, we are all social animals, and having to stay at home without meeting anyone is again going to take a toll on our mental health in terms of depression and other various mental health issues. And also the loneliness. Virtual classroom for kids, especially for parents who are having toddlers, it's going to be a nightmare. And having to attend their, making your kids to get up on time and getting them ready to attend the virtual classroom is again a challenge. And also amidst this situation, there are a lot of financial issues and job insecurity. So this is a new challenge we're facing apart from all the stresses. And the fact says that work-related stress is a common major cause of occupational ill health, poor productivity, and human error. And in factories and other places also, because of the psychological consequences of COVID-19, there can be a spike in human error. And presentism takes a toll on business than absenteeism. Presentism is nothing but just being present there, but mentally you're absent, literally. So that is again a major problem. These are all like research proven findings, and more workers are absent from work because of stress and anxiety more than the physical illness. And being absent literally even from work from home. Now people are complaining about having this fear even after the COVID has subsided, after the quarantine period also, they're not able to be productive as good as pre-COVID times. So these are the other challenges faced by corporate as well. And researchers have shown that employees who completed at least one session with a mental health provider had a significant improvement in their work performance and decrease in absenteeism and increased productivity. That's why in par with physical health, mental health is always being ignored. And when it is also considered, definitely you will see a lot of positive changes in their productivity and the health aspects. And just I'm going to show you these slides. I'm not going to explain much, just for some awareness only. Effects of stress on work. What kind of work? Because of this COVID stress, we could see these impacts on employees' life. So the low productivity, job dissatisfaction. We may lose a lot of talents now because of this COVID-19 issue, because people are now prioritizing their life. They are not even thinking about hike or any other money or even salary. They just want to live right now. And because of that, small stresses in job will definitely cause them job dissatisfaction at this juncture. And reduced efficiency, they also have conflict with co-workers, not literally in their presence, but also through meetings and all that stuff. And also absenteeism issue, worker turnover, and lack of career advancement. People are not going to think about career advancement at this juncture, and which can lead to poor work relations. And to talk about stress, just take a look at how much stress can take a toll on long-term health in us. So COVID-19 stress will be with us, like rightly it's put in the brochure. This COVID-19 impact is going to be there with us for a very long time. It's going to linger. And obviously, more than the positive thing, it's going to leave a lot of negative things on us. So we should be very careful to handle this stress very immediately, especially employees' mental health has to be handled. Otherwise, it will lead to long-term consequences also. So it can starting from neck until your liver and pancreas, heart, and always a lot of researchers have proven that lifestyle disorders like coronary heart disease, type 2 diabetes, it's all purely because of stress. And it's very important to alert the employees about their stress symptoms. And I would suggest organizations to have this kind of things which can be circulated to your employees so that they will be aware to find out stress in the beginning itself. Because many times whenever I deal with my clients, by the time the stress has taken a toll on their health and other areas of life, even it has to have a very bad impact on their marital life and other areas of life, only then they will come to know that they're stressed. It's very important to know the early warning signs of stress. Only then they can actually implement some coping techniques so that they can come out of it very soon. It can have an impact on your cognitive symptoms, cognition, that means your thinking, the ability to concentrate, which is very important for your efficient work. And they will only see negative, even though you're going to give a lot of advices, they won't be able to listen. And emotional symptoms will be there that can lead to a lot of conflicts, and physical symptoms which can lead to absenteeism, and behavioral problems which can have an impact on the health. So indirect signs of stress also should be noticed in the early period itself. It can result in increased smoking, alcohol consumption, or drug abuse. This can be a early warning sign that a person is getting more stressed. An increased use of prescribed medications. Already people are like doctors, they themselves prescribe medications whenever they have this headache or whatever physical aches. So that is definitely not a good sign. So they should know that they're getting stressed. And use of sleep. Nowadays, I hear from my clients, they are binge watching Netflix, they're binge watching web series. That is again a sign of stress. And increase of over-the-counter rates for sleeping or relaxing. People are nowadays taking sleeping pills because they're not able to handle COVID stress. And increase of consumption of coffee, tea, colas, chocolate. All these are like binge eating because they're not able to handle their emotions. And seeing medical doctor for tension-related health problems. Now I see a lot of cases spiking wherein after people have come out of this COVID-19 also, they have this fear whether, am I going to develop heart attack because I can feel the palpitations. It can be a symptom of anxiety, but it's been wrongly misunderstood by them because they cannot really understand whether it is a real physical issue or a mental health issue because of the lack of awareness. And they may spend a lot, So all these are indirect symptoms. And common mental health problems due to COVID-19. I've just listed a few mental health problems which is on the spike right now because of COVID-19. Existing mental health issues are also got exacerbated, and also new mental health issues are also coming up. Even we can see all this in employees also. Whenever I address any corporate group or even education institutions, after the webinar, I could see a lot of people complaining about mental health, symptoms, not knowing those are mental health symptoms. And I would say at least 70 to 80% are having these kind of symptoms like anxiety, palpitation, and also this restlessness, anger, irritation. So anxiety, stress, depression, obsessive compulsive disorder, to just talk a little bit on it. People who are already having this OCD, they will get more, because of this COVID-19, their hygiene would go even 100 times. So they really keep on washing their hands. I've been getting cases wherein they keep on bathing for 2 hours, keep on hand washing because of that they've got some skin problems. And post-traumatic stress disorder, eating disorders, even among children, we could see this now. Eating and sleeping disorders, bedwetting, substance use, and they're having to resort to alcohol. And this also, I'm not going to go to details because of the want of time, but I really want to bring this awareness in this important forum. So these are some of the hallmark symptoms of mental health issues. And it's really surprising to know that even most the educated people do not know these are like symptoms of mental health issue. And they think that, okay, it will just pass. But after 1 or 2 weeks, if it continues to stay, then we need to really think about it. We really need to take steps. And among employees, this kind of awareness can be spread in terms of, virtual brochure or something so that they can analyze themselves whether they have these kind of mental health issues. Feeling sad, confused thinking, guilt, mood swings, withdrawal, sudden withdrawal, the person is suddenly not wanting to talk to anyone, suicidal symptoms, like talking about suicide and thinking that it's a burden, detaching from reality, paranoia. Paranoia is like being paranoid, like thinking actually it is not existing, but they think that it is, they have this kind of false belief that is delusions. And paranoia is like doubting. Okay, so an hallucination is like seeing something which is not here or hearing something which is not there. So these are all some of the symptoms of mental health issues. And they won't be able to handle even a small stress in their lives. And trouble understanding relating to situations, problems with increased alcohol or drug use, major changes in eating habits. Some people may binge eat, some people don't feel like eating. So all these are symptoms of mental health issues. Now coming to the employee well-being in corporates, this is a very nice picture which explains it all. Like, do you bend or break? See, when all the employees are exposed to COVID stress, it's not that everybody reacts in the same way. Our employee experiences are different. So some people succumb and some people become resilient. Some people actually thrive also. So in a corporate, you need to really compartmentalize those people, and based on their needs, then we need to custom make our programs. So some of the tips for the corporates. And so to create the well-being culture, so like Dr. Mahesh talked about positive attitudes, like a well-being culture where it has to come from the top, and the top management should believe in the well-being culture. And when we are going to think about short-term profits, we may miss out on the big picture. So it's very important and pertinent to think about the well-being right now. And break the stigma. Now the stigma is attached to COVID-19. People are not even wanting to come and tell that they have some problem. Okay, so this break the stigma and encourage people to open up and ensure confidentiality. I hope a lot of you must have heard about Maslow's hierarchy of needs. Right now, we are all in the second need category, that is need for safety. Everybody are talking about need for safety here. So as a corporate also, we need to address this need for safety. And only 3 things we need to address the employees now. One is their safety needs have to be met. Next is their social needs. Social needs can be met by arranging some virtual meet and all that, at least once in a week, and taking an interest in it to bring them together to improve their social cohesion, and also to add some purpose and meaning into their lives and making them feel that they are needed right now and the company needs them. That kind of feeling has to be brought into the employees also. And this time can be used for upskilling. Some opportunities can be given. People who can take it right now. And I'll be just closing in 2 minutes. And policies to improve their work-life balance And provide, it's very, very important. Company has to be supportive to them at this period of stress and strain. All they look forward is some support and people who can listen to them. So that kind of infrastructure, flexibility and support when given for people, they are able to function properly without the fear. And we are in need of compassionate leadership at this moment. And improving office ergonomics when they come back to work, when they're going to bounce back from the stress. So that will be helping them. And identifying the at-risk employees can be of great help. So these are the points I just mentioned, and provide recognition. That's not a big deal, where monetary benefits may not be given. I know the company is not doing quite good right now. So instead of giving any financial incentives, this kind of recognition and shout outs for those who really are performing well, that could be a very good initiative. Finally, the very important point is try to build the trust. Based on trust only, everything can form. Whatever improvements or initiative a corporate is going to take, but if they don't trust you, then they're not going to fall in line. So it's very important that we build trust by being more transparent and honest, and reach out personally and show you care. It's not about money again. It's just about how are you and are you feeling fine. The team leaders, it has to start from the leadership. And I'll be stopping. I understand we are running short of time. So keep them updated, maintain open communication. And as I already told you, mental health awareness campaigns by passing these kind of information, and periodical mental health screening and counseling and mental health services. Needless to say, that is very, very important by giving this kind of services when it is very much needed. So for want of time, again, I'm also stopping here. We'll bring about other points in panel discussion. Thank you so much for the time and the opportunity. Thank you once again. Have a nice evening.
Thank you, Dr. Chitra, for a wonderful presentation talking about the positive mental health, exploring the signs of stress, how do we handle it, and for the beautiful recommendations. We will explore more in the panel discussion. Let me open up the panel discussion with my opening remarks. We heard Dr. Balaji talking, Dr. Mahesh talking, Dr. Chitra explaining different aspects of COVID. And I am sure all of us have seen many memes in the last year, like, can we uninstall 2020? That's something which has virus in it, right? Little did we know that the virus is spreading like a wildfire. And even after almost, I guess, 500 days plus, we are still coping up. We are still getting up. We are adapting to a life under quarantine. We are finding different ways of working from home. We are unfortunately losing livelihoods, jobs. We are losing our loved ones. A lot happened over the last 1.5 years, and many are still coming to terms with what they have lost and what they have gained. We as a human race has always survived many battles, but this pandemic shall also pass. The question I have as an individual is, are we prepared to face the aftermath post-pandemic era? Are we really ready? COVID has given us, interestingly, more time to nurture our relationships, if we see the positive side of it. Save the commute fatigue. I'm like happy that I'm not driving anymore. I'm not standing in signals, right? That's a positive sign there. More opportunities to explore different ways of working, right? It is pushing us to innovate and identify a lot of new things. As these positive side effects balances out the negative side, well, I still wonder. We have long working hours now. We have an increased load at home, work from home, work for home, or confused what to work, or there's no work. We have stress, burnout, grief, loss, financial instability. There are many negative sides that's there. What could be the strategies business can adopt to build such a resilient workforce? For sure, business are not built only on wealth, right? It is the human asset that's very, very, very important there. What do we do to ensure that our employees' mental, physical, and all emotional wellness is taken care? All of the speakers beautifully gave tidbits about how do we handle this. I was in corporate side for years. Stress and burnout were the additional perks as part of the growth that all of us got it. But at this juncture, while we are innovating business strategies and adopting new ways of working, I still think we need strategies for preventive measures and to address the overall wellness. I would think it's multifold, ensuring employee-friendly policies, better healthcare for workers, maybe employee assistance program for COVID-affected families, sustained holistic health and wellness programs, counseling help to address employees' mental health, etc. let's just hear from our panelists on their thoughts on this topic. I would conclude my opening remark here. Dr. Balaji, I would like to start with you first, please. As a layman, we have got a lot of Google doctors, we have got a lot of WhatsApp experts. The information overload is so much that I myself, being from this field, is so confused, right? How do we really handle this information overload?
I think we lost.
Dr. Balaji?
I think I missed the last part of the question, Sai.
Okay. Yeah.
Yeah, I can hear you now.
Sorry.
Can you
I
come
was
back
saying
again?
that how do we handle this information overload, or rather misinformation? Dr. Mahesh talked about little in his presentation. I wanted to have it in detail because I'm sure that's the question all of us are having. Starting from mask to
Right,
Covaxin
okay.
versus Covishield.
I know. Even today we had a lot of discussion about it. These days, these messages, what's happening in the media and social medias, spread was faster than the COVID virus itself, and that seems to be the problem. And obviously, people sitting at home, they have a lot of time to access all these social media messages, and that's when a lot of confusion arises. I think your best bet would be to filter out all these unwanted, unknown source of messages, and make sure you listen to proper advices. Maybe your family physician or experts. I mean, as you know, we do have a lot of like the Siki. There are a lot of people who do regular webinars, give some information. Mind you, this COVID-19 is a new disease. Even doctors didn't know anything about this disease until earlier part of last year. To be frank, even today, we don't know. I mean, probably Mahesh will agree with me. He deals with hundreds of COVID patients. Even today, we don't know the exact nature of the disease, course of the disease, treatment for patient. Everybody behaves different to the virus illness, and the outcome also varies. We are not just able to predict, even though we have some kind of scientific data coming from like a WHO. For India, we have like ICMR and things like that. We still are not sure. For example, vaccine itself, we have some data, we have inconclusive data, we have different types of vaccines coming from different parts of the world. I mean, do we have, because all these scientific data, what we have today, they're all fast-tracked. For example, vaccine. The previous vaccine technology used to take a decade, at least a minimum of 10 years for the development. And now, within 10 months, we could develop a vaccine. And it was fast-tracked. The government got approval, and we started vaccinating. Is it going to work? Is it not going to work? Does it have any side effects? Now that the vaccine has been in the market for some time, we have started seeing some reports of side effects of vaccine. Does it mean that vaccine is good enough or not good enough? We don't know. But as of today, we have to listen to experts with experience and take the word for it. That's what I would say.
Thank you. Thank you, Dr. Balaji. My next question in continuation to it is to Dr. Mahesh. Dr. Mahesh, you talked about a lot of strategies workplace can implement after they come forward, right? So what could be the additional strategies? Like, there are companies which are mid-sized. There are corporates who are willing to spend. You talked about the budget there. We can't decide that. But what could be the bare minimum thing as part of the psychosocial rehabilitation that we have to follow post-COVID? For example, I was reading a news article, I think yesterday, that Singapore has got a 1-minute rapid COVID test. And if it's like you are with your breath itself, right? Not the swab. If it's coming positive, then you go for the proper RT-PCR test, right? So is there something that's going to come up? What could be the bare minimum strategy you recommend for any companies to do, irrespective of their size?
Yes, thank you. I think very important question, because I think the financial health of companies are also taking a toll because of COVID. So how much resources they are going to allocate for this new budgetary expense because everything has a cost. So I think masking and vaccination are two strategies in prevention which are well proven. As Dr. Balaji has alluded, that it is a new technology. The vaccine came out very fast, and what we know for sure about vaccines is what are available in India, that after 2 doses of the vaccine, 2 weeks after 2 doses of the vaccine, you are reasonably protected from severe disease. That even if you can still get COVID, mild COVID, or asymptomatic COVID, but you are unlikely to have end up being in hospital for oxygen or in the ICU. So vaccination and masking. Masking definitely is very proven and effective to reduce the chance of transmission. Different masks are available. The 3-ply mask, which is what we call the surgical mask, is very effective and reasonably comfortable to wear for long periods of time. When you're talking about people wearing masks in for the entire 6 hours or 4 hours they're working in being in their workplace. So companies which are small, medium size, which have limited resources should invest in masks. Definitely to provide a clean mask every day to every employee, that would be definitely a good way of mitigating the risks. And other thing is to look at cheap ways of improving ventilation, because when the air circulation is there, the minimal chance of airborne transmission is reduced. So look at their workplace, and the shield which I showed in the picture earlier on was a very cheap way of mitigating risk, where customers are expected and customer behavior can be errant. So they might suddenly pull out their mask and cough or talk. So cheap, effective measures are there to improve ventilation and masking for all the employees and individuals, and having sessions and discussions on vaccination, and to have a core group or few people who are educated a little bit more about vaccination to take on the questions and the kind of bust the myths surrounding vaccination, like what we've seen in social media, and Dr. Balaji alluded as well. A lot of side effects are there, but what best scientific evidence we have now is it saves your life from preventing you from going on to the ICU or needing oxygen. So to kind of bring back the fact, yes, you may still get COVID, but then this is the best chance you have. So masking and vaccination is what I would expect and from the employers to take a lead for their employees.
Thank you, Dr. Mahesh. And I think I would also add on to it, saying that we should also have a session to people like the entry-level workers and everybody on how to wear the mask. Mask is to cover what portions of the face is very, very important. I still see people covering their head, their jaw, everything with mask, but not something which they want to really cover. And now, Dr. Chitra, the next question is to you. Yesterday, I was getting a call, rather a panic call from my mother. She got a forward from somebody stating that people who really die after 2 years. And she was calling and, I have got this message, what should I do? I said, just delete the message, right? So when I was discussing with her, I was just thinking, right? COVID is one side where we have to handle the physical part of it, symptoms and other stuff, right? This fear of dying, the fear of something is going to happen to me, I personally think that is killing more. Right? I mean, going and asking for remdesivir in queues when doctors are saying just hold on, no, and fighting for bed where the persons who are really supposed to get bed is not getting. The fear of protecting self, or the fear, right? How do we handle that fear factor in an individual?
Yeah.
Are the Dr. Chitra?
Yeah, so I got the question. It's about handling an employee's fear. So as you rightly said, whenever there is a problem here, disease or something, even earlier and all, when the person get a heart attack, later the fear will be there at least within for 6 months. Okay, if whenever he gets some palpitation, things, is it a heart attack, or we call it as a psychosomatic problem which can develop after a disease has actually subsided. So this is kind of a psychosomatic problem, and I would say actually the antidote for fear is faith and hope. So these are the things which is missing here, and I wouldn't blame our people, because all of us, including psychologists, everybody is under fear only. But when is the fear spiking up is whenever we hear all these toxic things. So as Dr. Balaji said, we need to do critical thinking here. Critical thinking skill is missing among us, I would say. When somebody sees something, it's not a fact, it's just the opinion, or it may be a fake news also. We don't know. We don't have much in control. So I always tell people, think about what is in your control and just then think about what is not in your control. And there is nothing going to happen worrying about things which is not in your control. And I say the serenity prayer to people, like there are only two things. There are certain things in your control and there are certain things which is not in your control. So God, please give me the courage to change the things which I can, and also to serenity to accept the things which I cannot change, and the wisdom to know the difference. Knowing the difference is the best part. So it's COVID is something which is, as the doctors already discussed, just a very new thing, and we don't even know what will happen if we vaccinate. We're all hoping that it's going to be good. It's a positive thinking which is helping all of us here. And that is the reason people are coming up with all this kind of fake news, because it's not like 100% nobody can say this. That's the reason people are coming up with all these kinds of situations, because of taking advantage of the uncertainty here. So what I would say the employees is better, we have to stay away from these kinds of news which will increase and aggravate your fear levels. And whenever you feel like your fear is going out of control, probably you're affected by a mental health issue, that is anxiety. And we need to take psychotherapy or counseling for this kind of anxiety and fear issues. If it is like out of control, let's say if it is going to be with you for more than 2 weeks, and also in more intense, you're not able to sleep and it's interfering with your everyday affairs, only then you need treatment. Otherwise, no treatment is necessary. You need to just cope and divert yourself, and 1 or 2 weeks it will pass by itself. Okay, well, the thing is, the faith, or earlier and all, we had spiritual beliefs and all that. Nowadays, it's not, even people are not believing in God because of this COVID situation. But I would again reinstate that faith is very important, which is very important, and which will keep us very positive and hopeful amidst all these things which we are facing.
Thank you, Dr. Chitra. My next question is to Dr. Mahesh. I'm a yoga practitioner myself, right? So I get a lot of calls now saying that, can you teach me this pranayama? There is a Brahmari thing, there is a forward there. You know, if you breathe so much, COVID doesn't come. Can we do all that? I wanted to check practically from a medical science perspective, how much of this breathing helps? Because I see people breathing from morning till evening doing the practice. I keep telling them too much of it is also going to be harmful, but you know, they keep doing the Brahmari part, which exhaling so long is not good, right? So I wanted to know how scientifically it's true that these kind of breathing practices help.
Well, I think when you're well, we're talking about situation when we are well, how we are preventing COVID. I think definitely physical well-being, improving your physical well-being is important. And to an extent, when we have this breathing exercises, they do recruit other areas of your lung which are not normally used. So there is some science in saying that breathing exercises do recruit more of your lung, and it is good for your health. Apart from breathing, I think it's to improve your cardiovascular health by physical exercises, which to an extent now is curtailed because of lockdown. So I think in some ways you're trying to do something about a situation, enormous task you're facing. So it develops positive attitude. It is better than doing nothing and more kind of increasing your anxiety and fear. It is certainly not harmful, doing breathing exercises. So if somebody, it depends on the spectrum, if they're moving away from fear, anxiety to positivity, in moderation, doing something about the situation is good, I feel. To kind of build up upon that and say, no, yes, you're doing that, but that alone may not be enough. Try different ways, other measures to kind of improve your health by improving your mental health, discussing with people, improve your physical health by walking. If you can't walk outside, what you can do inside. So to kind of build on that, because I think there are people who are trying to do something about the situation they're facing. I think they can be helped. So I think is to hold on to the positivity there.
Thank you, Dr. Mahesh. Dr. Balaji, I'm just going to ask you a very layman question, honestly, right? If I get to know that I have COVID, right, testing positive, as Dr. Chitra said, I'm not going to have that fear factor saying that I'll be okay. That's the positive angle. But from a medical perspective, what is the basic thing first at the situation?
Right.
And
Okay.
as a company, what do you think they can provide support for an employee who is reporting COVID positive? Both.
Okay.
Basic, just
I think
basic.
there are few things I think which as a layperson or an employee of an organization has to know. One, the moment you get to know you're a PCR positive or you're tested positive, do not panic. I think as everybody has been talking about, is an anxiety which probably half kills the patient. The moment they get to know, I mean, there are two types of patients. One, some of them tend to ignore their disease and then they go around spreading the disease. And some of them, they start panicking. Number one. Number two, the positivity, when the patient becomes COVID positive, we divide them according to the risk factors. How uh, how much risk they have in developing so-called severe disease. Again, these are all our predictions. Just because we say you're old, you have diabetes, you have hypertension, you have a cardiac disease, you have asthma. Um, uh, you know, it doesn't mean you're going to develop 100% a severe form of disease. But you are young and fit, probably your chance of developing severe disease is extremely less. Extremely less. Mark my word. Doesn't mean again you will not get. We saw in the second wave a lot of people, young people getting with no what's called no comorbidities, getting severe form of disease, but the chances are less. So what do you do? First, you try to isolate, get some medical help. That's what I would say. Get a proper medical help. Again, within the medical help, I can see that a lot of people get all sorts of advice from different kind of practitioners. I'm not talking about what type of doctors. So I think you should seek a proper medical help. If you're part of an organization, as Magesh was talking, each major organization will have what's called occupational health, who is nothing but the doctor attached to the hospital who knows probably a medical records and things like that. If you do not, I think you should contact your regular physician or a general or host physician. He can advise you properly whether you are at the lowest risk of developing severe form of disease, so you can get it, or if you're at risk, what do you do? Do you investigate further or get admitted for observation and things like that? And that is what you should do. But what you should not do is panic and become anxious and start running around the place.
Okay. Thank you, doctor. I hope all the panelists can hear me clearly, right? My questions?
Yes.
Thanks.
Yeah.
The next question I ask you, please. You touched upon work from home, which people are doing now, right? So though work from home is giving us a lot of comfort to be at home, but it's also increasing the loneliness of people. I am shut in a room for, like, if there is a 4 family member, all 4 are in 4 different rooms, locking themselves up, online classes, office work and everything, right? The family time in a way is reducing in some places, but at the same time, addiction or substance, everything is increasing. How do we handle this? Because there is no way I go out and have my recreation. I cannot meet my friends. Nothing is possible, right? The boredom or the feeling of being alone is in everything. How do we handle that?
Yeah. Okay. So basic thing is we should know what are the basic human needs. After the physiological needs, then comes the safety needs, then comes the social needs. So social needs are very important. After all, we're all social animals, and this need is extremely damaged because of COVID-19, and we're all like isolated from all the place, like you said rightly, so in their own homes. But then how do we get this need satisfied? Like this, I'm not able to find food. How do I eat? Similarly, I don't get the social need satisfied. How do I make it? But first thing is acceptance. Okay, like we can go without food for some times. Maybe when we are isolated or strangled and shipped, we say that, okay, I can survive. It's like a survival thing. Survival of the fittest game is going on right now. And probably we all have this hope that this will come to an end soon. So with that thing, I would say acceptance is the key. Once acceptance comes in, then they themselves will know how to cope up with it. So after they themselves will know the techniques, how to handle the situation. So even if there's no acceptance, I can give you some ideas. One tip is to have our everyday routines structured. It's very important because structure gives us some control. And when we have the structure, because I see people working from home, they don't even take bath or they don't even take care of the hygiene because it's just work from home. And because of that, they have a psychological impact on themselves, that they're missing out everything and they're feeling so sad and negative. So I would say that have some structure and get some life back in your, control. So that's very important. And for having the social connectedness, at least weekly once, you can take a phone because obviously face-to-face contact, nobody is going to entertain. So you need to have some virtual sessions, definitely with your friends, not only audio, even now video conferencing is, can connect people even from Canada or US or whatever. And connect with your childhood friends, buddies. So even though we are in this kind of fraternity, medical fraternity, and this kind of education, if you talk to a friend about your childhood experiences, that moment your stress is melted. So weekly once have the sense of connectedness. And where else your needs can come from, right from home also. You said like people are isolated. Bring them, reunite them at least for 30 minutes every day. You do some activity together. At least, there is a strict rule in my home wherein I have my dinner together or I do gardening together. And this will come only when the cohesiveness is more in the family. Let's say there is a lot of marital conflict and family conflicts, we can't expect this. That is where people suffer from loneliness. Otherwise, they all know I'm actually with my family, which I was longing for a long time. Let's say for a mother whose 2-year-old child is there in the next room. She'll be more happy that I'm united physically with my family. Like you said, feeling grateful. What have I, instead of always thinking, what have I lost? What have I got? So these are the things. So where is isolation? Except for people who are single and sitting at home and working, there is a real challenge. Others for family, always there is a possibility that you can reconnect with your family and you can make sure that all your conflicts are resolved, making use of this opportunity. Only when acceptance, yes, I'm going to be here for some more time, then you will know all the wisest things to do.
Thank you, doctor. I was just wanting to share a small experience there. I was counseling for a housewife. She was stressed out because she had to cook all the time, from morning till evening. But on top of it, her problem was like, she was irritated to make tea thrice and make coffee twice. That was her major problem, right? And I said, wasn't it before? No, it was okay. My husband was drinking tea at office. I didn't have to make. Now I have to keep making tea, coffee. I am like this chaiwala on the road. Then we worked on things on how to share work, how not to make a feast, but reduce, keep these things,
Yeah, but I'll tell you that these are the people who grieve more. Sorry to interrupt. These are the people who will grieve more when the husband has got COVID-19 positive. Oh, I should have made tea. I should have really given something when he really asked me. All this grief is going to be more for people who have missed out on these experiences, I would say.
We are made that way, right? We always long for things we don't have. Always. Now all of us want to go out. Previously, we wanted all working people to be home. Now we want everyone to go out home, right? So that's always happens. And I have a question from audience, maybe to Dr. Balaji or Dr. Mahesh. One sec. The question is, how can we progress to see the maturity level of healthcare in India to match the level of US and UK?
Excellent. See, what I always used to say is there is nothing like a perfect health system in the whole world. As I said, US spends 18% of GDP, which no other country spends. And Sweden spends about 8%. Australia spends about 10%. We spend about 1.5%. And if you look at what's called a UNDP, that is United Nations Development Markers, we are worse off than Sri Lanka and Bangladesh. Can you believe that? So there are a lot of sides to the amount of money you spend. Can you say that in US system is the best system in the world? You cannot, just because they spend 18%. But my honest figure will be somewhere around 8 to 10%. Or at least to begin with, India is looking at around 2.5. So even if you achieve about 5% of GDP in the development of public health, I think we've achieved a great deal. Because today, what we lack is good, affordable, accessible rural health care. If you can take care of the 70% of the population who live in the villages, I think our healthcare system will go a long way. For example, when Arun Jaitley introduced what's called Ayushman Bharat about 2 years ago, covering 10 crore population, 10 crore families, approximately 50 crore population. 50 crore population is only a fraction of the population. That is for the public health. And so-called the private health insurance covers only about less than 5%. What about the rest of the so-called the middle income group? Who's going to look after them? So I think this is a time where both, for example, insurance sector and the industry as well as the government have to come together. There should be, like somebody talked about, like Mahesh clearly said, this is the time we'll look at what's called a group insurance. Every organization has to take care of the employees. That itself will cover majority of the population. Similarly, government also has to cover, not just 10 crore families. They have to go beyond that to cover many more people. Only then we can, come together closely and then improve our healthcare system. And we are not looking at super duper tertiary healthcare here. We are looking at basic. I mean, today, if we go to villages, we are looking at people lack intravenous fluids when they have basic gastroenteritis. And a lot of people, you must have seen in UP before COVID, a lot of children died because of lack of oxygen. I mean, not now. Even 2 years ago, there were episodes when places like Madhya Pradesh and Pradesh, which lacks basic healthcare, the day of basic want of IV fluids and oxygen. So the system should change. I hope we all have a hope for the future. Yeah.
Yes, and also to add, I think if I remember the data right, US and Europe size together. Can you hear me? Can you hear me?
Sorry, we lost you there.
Sorry, can you hear me now?
Yeah.
Now better.
Of saying that the data if I remember the data right, US and Europe together population is just little above India. The infrastructure setup, we are not made for social distance itself from a country perspective. Right, so that's how things are there. But then there are improvements that we are planning. There is a question in chat. Let me go there. Okay. On what situation a COVID patient opt for oxygen support because there is a confusion among COVID for a quarantine or after medical supervision? Dr. Mahesh, would you be able to take the question?
Yes, I think a very important question. I think the first step, as Dr. Balaji alluded, is to kind of not panic and then isolate oneself, because what we see now is many members of the family getting affected simultaneously. So the sad situation of all 3, 4, or 6 people in the family getting affected, even if one of them needs hospitalization, it's quite difficult to go about organizing things. So the first thing is isolation and then monitoring. So, and Dr. Balaji already alluded to get proper medical advice, whether it is the family physician or you're getting online advice or you're going through your organization's occupational health, proper medical advice. And what we usually tell is monitor your temperature, and if you can get access to an oximeter which measures your oxygen levels at your fingertips every second hourly or third or fourth hourly. And by and large, we see majority of the patients get through without any problems. Those who have become COVID positive at home, mild symptoms, monitoring, taking care of their hydration. Quite often people miss out on, they have to drink plenty of water because they are having fever, they lose a lot of water, they forget that. So 2 to 3 liters of water and good food. The appetite is cut off because of the illness. So many people know once they have their hydration, their appetite, somehow trying to get good food in and have good sleep, with a positive attitude, come out of it with home isolation. When the readings are starting to fall below 95, 94, again, there is a problem with these oximeters. Some of them are not very accurate. So you'll have to wait for readings, and no way of checking it is if you clean it and get the oximeter checked on a normal person at home. If it is kind of showing different readings, then the reading is most probably correct. So if the readings are starting to fall below 95, and again, you can't decide for yourself. The medical practitioner who's advising you, you should let them know that you're monitoring and then now it started to drop, then the need for oxygen arises. Again, there are so many other aspects to the care which will be individualized. So if somebody is elderly, whether they're moving, they're falling down, that would mean hospitalization, even though their oxygen saturation is normal. So there are other aspects which may kind of indicate the person needs hospitalization, not just the saturation. So it is individual advice to the individual patient. So if you're talking about a fit, well person who's monitoring at home, then a drop on saturation below 95, and with medical advice, they have to look at least, even though they might not be put on oxygen straight away, the potential for need for oxygen is there. So sometimes we do let people 91, 92 who are otherwise well, we just monitor them, and no, we don't give oxygen. So that is why this area of uncertainty with practices varying between patients is misrepresented, and so there can be a source for confusion.
Just one clarification final. Is it a different oxygen level for patients with comorbidities?
It is very individualized. I think I would say, depending on the patient situation, no. I think in terms of oxygen, the decision is whether it is safe to continue monitoring at home or we'll have to monitor in the hospital. I think that is what the decision is. So once the doctor who's looking after a individual patient advises, let's get hospitalized, it doesn't mean 100% they'll get oxygen. They'll be continued to be monitored in the hospital because the chance of needing oxygen is high. And in terms of patients with comorbidities, it's no different unless there is some other factor determining. No, I don't think there is no need to have these two variations.
Thank you, Doctor. Dr. Chitra, to you from audience, what would be your suggestions or advice to students attending online classes?
So right now, this is a challenge. So there is a lot of uncertainty in this education field. Some students take it very lightly that whether I'm going to face exams or not, so why would I even attend it? And many students are distracted. So I would say people who are in a concrete stage of understanding the level, like let's say who are in the 10th grade or so, I would definitely recommend them to please pay attention to the classes, even if you find that the classes are not useful, because as said by many students actually, because online classes, they say that they don't find it useful at all. Even though you have to pay attention and follow the self-discipline as if you're going to school. The transportation is not there. So whatever time you have to get ready and go in and sit in front of the monitor and try to attend the classes. If you don't find anything useful also, you have to read the textbook. And that particular hour given for online learning should be utilized only for online learning, and strictly no need to use their mobile phones or social media and those aspects of life, because education is for gaining knowledge and not for the marks. That part of the students have to understand really, because if they go to 11th and if they don't leave out the knowledge on 10th standard basic level, definitely they're going to miss upon it. And they're going to suffer later in their higher education. So better focus on it, or if you can't find it, get some tuitions at least, and always stay in par with the classes what's going on.
Thank you, Doctor. There's another question from audience. I think I asked it in a different way to Dr. Mahesh. Just repeating the question. Companies are already having low profitability because of the pandemic. How can they spend more for their employees' mental well-being? What are the frugal and non-expensive measures they could do? Mental health. I think for the physical health, Dr. Mahesh talked about the bare minimum thing of sanitization and masks, which are very necessary there. So, the bare minimum mental health support that company can provide, considering the low profitability there.
So this question is for?
Sorry, physical, from a medical side, Dr. Mahesh, I have asked this question and he has answered the panel discussion. So from a mental well-being side, companies are facing for what could be the
yes.
they can spend on.
Okay. See, even though they're facing a lot of financial pressure, there'll be budgets for everything, and at least minimal allocation is very, very important, because if it is not going to be attended right now, it will cause a lot of consequences in the future, which they may not foresee it right now. So you need to spend, it's all about how you're going to, make your expenses. So it's very important that, again, as I told, because mental health is not taken as a priority. That's why they think about frugal expenses to be made on that. But okay, to answer that question, even if you're not ready to spend that much money, there are a lot of NGOs who are available to give 24/7 counseling, which is free of cost completely. So you can tie up with such organizations and make sure it's all about trust. Finally, it boils down to trust. No money is involved here. So they're to just show that employees that we do care. And also about the circulation of these brochures, even I have it in my website also. All these are free of cost. You can circulate to all the employees and say, if you have these symptoms for a long time, probably you need to talk to the counselor who's available for you. These kind of practices does not involve any kind of money also. And they can do some self-assessment of their mental health also in case money is a problem. There are a lot of other ways HR can come up and they can talk to a psychologist who's ready to do something for them, and can be done in a bare minimum cost itself. And yoga programs, meditation program, at least one webinar, if you could organize once in 3 months, that would be highly effective for people. They can go away with some handouts which they can practice once in 3 months at least. This kind of programs or a regular tie-up with the organization where they can do yoga, meditation practices, mindfulness practices. Once in a while, this will have a good impact on the employees.
Doctor, just to add in there, for the companies I coach, what we do, the companies who is not able to afford, we do the webinars, as she rightly said, and we also tell them that this is the person to whom you can reach out to when you want to have help. And we tell the management very clearly that the cost of making the employee non-productive out of stress would be very less compared to spending on improving the mental health of that employee, right? When they see the return of investment, they understand, right? Because there is a stigma all around, right? So why do I do it? Like employees will fix it. That has to go at a management level. Is I personally.
Leadership training would help. Leadership training. Leaders at least can be, if not all the low-level employees need to be given this awareness. Very few leaders can be handpicked and can be given some first aid, how to have this peer counseling and all this stuff. They can be trained at least.
There's a question. Does remdesivir increase the oxygen level?
Sorry, I missed you.
Does remdesivir increase the oxygen level? Can you hear me?
Yes, I can. Yes. See, I think I should talk a bit around this drug. I think it is chosen by doctors in very few selected patients. Unfortunately, it has reached the media, social media first before it reached the actual doctors. So I think the focus has shifted to the drug, which is it is not useful in everybody. And no, there is clear scientific evidence that if somebody is actually too ill, we don't use this drug. So to understand, this is not a life-saving drug when somebody is already very ill with COVID. So there is a narrow window in some people where it is indicated. So I think what we use to improve oxygenation level is oxygen and oxygen only. There are few other effective drugs which are not expensive and which have been there for ages, which we are using in COVID, which nobody talks about. I think it is just unfortunate that remdesivir has found media's and people's attention and led to many unfortunate things like the type of crowding we have seen to get this drug and the type of distress families go through when they have failed to get the drug for their family member, relative who's been unwell. So it certainly doesn't deserve the place what it is being given right now. But doctors do use it at selected points in care of COVID patient. That is useful at that point. But I would not go to the extent of saying that it improves oxygen.
Don't forget the business and black market. I'll just do a last question to Dr. Chitra. It's almost time. Most of my male employees think mental well-being is something of a stigma and do not cooperate. How can I work with such employees? Sometimes there is a poor cooperation from the senior executives also. Any suggestions?
Okay. Yeah, because there's a lot of stigma attached to it, but things are changing nowadays. You have to give some kind of visual appeal to it, like even from the media kind of thing it has to come up, or you can make a small short film about it and give a lot of awareness to it, and also be like a role model. By you representing the whole thing, like I have a mental health problem, so I don't mind going to it and making it a lot more transparent. So people also feel, because it's all about following the role model. So that is one way we can do it. And by creating a lot of awareness campaigns, this kind of stigma can be easily dissolved.
Thank you, Doctor. And we'll close the panel here. Thank you so much. I'm just closing it with, we all talked about the positive statements in every one of our talks. So there's a quote from Gita, which is saying, whatever has happened for good, whatever is happening, that's happening for good. Let's all pray that whatever is going to happen, that will also happen for good. Stay positive. And I think pandemic, anything that shall cross. Thank you.
Thank you, Sai. It was a wonderful moderating. I would like to thank our speakers for accepting our request to be a part of this session. I would also thank the participants for taking. I'm looking forward to your continuous support. Request you all to visit our website to know more about our upcoming event. Thank you all once again. Have a wonderful evening and a safe days ahead. Thank you. Thank you, speakers, and thank you, everyone.
Thank you.
Thank you. Thank you, Bhavani. Thank you, Sai.
Thank you. Thank you, Dr. Balaji. Thank you, Dr. Mahesh. Thank you, Dr.
Thank you.
Chitra, for your
Thanks.
thank you.
Welcome.
Bye-bye.
Welcome. Bye.